Ever wondered how such a simple tool like a sickle could become a cause of distress for farmers? A slip of the hand, a moment of distraction, and the sharp blade can lead to an injury. And more often than not, a basic first aid kit isn't within arm's reach in the middle of a farm. Enter Kishan, a man with a vision. He thought, why not turn the very tool that can cause harm into a source of immediate relief? His idea was as brilliant as it was simple: incorporate a basic first aid kit into the handle of the sickle itself. Picture this: a farmer is out in the field harvesting his crops. Suddenly, he nicked his hand with the sickle. Instead of leaving the field, searching for a first aid kit, he simply unscrews the handle of his sickle. Inside, he finds everything he needs to clean and dress the wound: antiseptic wipes, bandages, medical tape, maybe even a small pair of tweezers to remove any debris from the injury. It's immediate care right in the palm of his hand. Kishan's idea isn't just about convenience. It's about reducing the risk of infection, speeding up the healing process, and getting farmers back to work as quickly and safely as possible. It's about transforming a potential problem into a practical solution. The problem was clear. Farmers, while using a sickle, were at risk of injury, and immediate first aid was often not available. The solution, as Kishan proposed, was to make the first aid kit an integral part of the sickle itself. By placing the first aid kit inside the handle of the sickle, it would always be there when needed, turning a moment of distress into an opportunity for prompt care. In conclusion, Kishan's idea is a testament to innovation, a simple yet effective solution that addresses a common problem faced by farmers. It's a reminder that sometimes the best solutions are those that are right in front of us, waiting to be discovered.